Hi, I'm Isabella Bryant. Today, February 1st, I'll be presenting my case presentation of septic arthritis. A 4-year-old male presents with sudden pain in his left hip that began 10 days ago. The pain was non-radiating but aggravated when moving the hip. Upon examination, the patient was feverish and appeared pale. The child kept his left hip in a flexed position and the anterior region of the hip was tender. However, the hip didn't appear swollen. All active and passive movements were restricted due to pain. The patient's surgical history showed tonsillectomy due to tonsillitis. Septic arthritis is also known as bacterial arthritis. It's a direct invasion of the joint space by different bacteria and viruses. Gonococcal arthritis is a gram-negative bacteria. Gonococcal means a bacterium which causes gonorrhea. And gonococcal arthritis is more susceptible to young, healthy individuals and more commonly seen in women. Specific strains in gonorrhea have been known to have viral factors that have been associated with the spread. These specific strains contain an outer membrane called porins that make the bacteria more resistant to antibiotics, and it also diminishes the host's inflammatory response, making it even more harder to treat. Unlike gonococcal arthritis, non-gonococcal arthritis, which is a gram-positive non-gonococcal, meaning infection not caused by gonorrhea bacteria. Staphylococcal aureus is the most common bacteria found in non-gonococcal arthritis. The bacteria can cause a staph infection, which then can cause a skin infection or a nasal infection, and that infection can result in non-gonococcal arthritis. Other gram-positives like Streptococcus pyogenes can cause tonsillitis, pharyngitis, and other inflammation of the throat. Streptococcus pneumonia is another common gram-positive that is known to cause a range of infections from ear to sinus infections to pneumonia and bloodstream infections. Viral infections like meningitis, pneumonia, and the common cold that are already inside the host can cause a secondary bacterial infection that can be spread through the bloodstream and infect joints or other surrounding tissues. Joint trauma is another way for the bacteria, either gram-positive or gram-negative, to get into the body, either through a puncture wound, animal bite, or a laceration to the joint. Lastly, in rare cases, osteomyelitis, an infection of the bone, can spread adjacently to the joint space and cause septic arthritis. The background on septic arthritis is that it's, as said before, a bacterial infection of the joint space. Arthritis is the inflammation of the joint that can become infected if invaded by bacteria, either gonococcal or non-gonococcal. Sepsis is the body's response to fighting an infection, but it can damage its own tissue and become life-threatening if not treated. The annual cases of septic arthritis remains 4 to 10 cases per 100,000 patients. An estimate of cases in industrialized countries is 6 per 100,000 of the population. Prosthetic joints or history of joint disease are more at risk for septic arthritis. And in 50% of most cases, larger joints like the hip and the knee are usually affected the most. There are several risk factors for septic arthritis. In gonococcal infections, which are usually more seen in sexually active adolescents and newborns. And I say newborns because if a pregnant mother has a gonococcal infection, she could potentially spread that to her newborn baby during labor. In non-gonococcal infections, a history of staph infection, skin, or sinus infection could potentially be a risk for septic arthritis. Surgery is another risk factor because in some rare times, if the equipment isn't clean, if it's not a sterile environment, non-gonococcal bacteria, non-gonorrhea bacteria could potentially find its way into the body that way. Low socioeconomic areas lack clean water and food. Bacteria and viruses are common in dirty water and unwashed and uncooked food. If a patient has diabetes, septic arthritis is a risk factor because the drugs diabetics take can sometimes suppress the immune system, which then leaves the immune system unable to fight against infections. Patients with human immunodeficiency virus, or HIV, are more at risk for getting septic arthritis, because not only does it suppress the immune system from fighting infections, another way to get an HIV infection and be at risk for septic arthritis is sharing drug needles with someone who is already infected with HIV. Patients who have joint prosthetics are at more risks for infections in prosthetic joints than in natural joints. Drug users, such as heroin users, are at risk for septic arthritis because they could inject themselves with a dirty needle or sharing needles, which can increase the risk of infections. A history of chronic joint disease, especially rheumatoid arthritis, are at risk for infection because of the chronic inflammation of their joints. There are many different ways that the bacteria or virus could spread throughout the body or enter the body. On this slide, I've made a concept map flowchart so it's easier to figure out how the bacteria gets into the body and then what happens after the bacteria gets into the body. So first we start with the gonorrhea infection, and that enters the body. Then the bacteria will spread throughout the body through the bloodstream. The synovial membrane doesn't have a basement membrane, and so the circulation of blood is very high around joints, allowing the microorganism to enter the joint space and infect the synovial fluid inside the joint space. And the synovial fluid functions to reduce friction between cartilage during movement. After the bacteria has entered the synovial fluid and has infected it, the body's inflammatory responses releases pro-inflammatory cytokines, which upregulate inflammatory reactions. However, cytokines can be bad when their expression causes inflammatory diseases, such as rheumatoid arthritis, or it can destroy cartilage and tissues. Another entryway for bacteria and viruses to get into the body and cause septic arthritis is through direct inoculation, which is an infection that occurs through an injection site, joint surgery, or just an open wound. Then the bacteria could either enter through that wound and spread through the bloodstream to the joint, or the bacteria could enter through the synovial membrane directly and then spread into the bloodstream, circulating throughout the body. The body responds by activating all immune cells to fight off microbial infections. Macrophages are released because they're very important in killing harmful organisms like bacteria and viruses, and detections of those bacteria and viruses. Also, macrophages release cytokines, which are, like I said in the last slide, pro-inflammatory responses to infections. However, like in the last slide, the excessive activation of pro-inflammatory cytokines can damage tissue, joints, and also suppress the immune system. The last way I'm going to talk about how bacteria or viruses cause septic arthritis by through a wound or a bloodstream is through osteomyelitis, and this is a rare example, but it can happen. So Staphylococcus aureus enters through an open wound or through the bloodstream. The bacteria then plants itself directly on the bone, or it could spread to the bone. And that's how it causes the osteomyelitis. But if the osteomyelitis is untreated and gets worse, the bacteria could spread from the metaphysis of the bone, which is the neck of the bone, adjacently to next to the joint space, especially if the joint extends up into the epithelial plate, allowing bacteria to jump from the bone to the joint space that's directly by it. The Staph aureus is then able to enter the synovial membrane because the joint is directly close to the bone, resulting in secondary septic arthritis, meaning it's not the main cause. And then the immune system will respond its normal way by releasing cytokines, T cells, macrophages to combat the infection. This next picture is a close-up of osteomyelitis causing secondary septic arthritis. What I just explained in the previous slide, this is just a visual to just make it easier to understand. So a direct invasion of the bacteria Staphylococcus aureus can enter through a penetrating wound or spread to the joint space because of the infection that's either on the bone or on adjacent soft tissues. And we also can see that it can also spread through the bloodstream. Symptoms of gonococcal arthritis and non-gonococcal arthritis have somewhat similar symptoms. The main difference between these symptoms is that gonococcal, which is also gonorrhea, has more symptoms around genital area, whereas gram-positive non-gonococcal arthritis has more symptoms surrounding the joints, and also patients show fever and chills. So in my typical patient presentation, it was a 4-year-old child. Upon examination, the 4-year-old hip was tender, but no apparent swelling. The physician mentions all active and passive movements were restricted due to pain. Other symptoms of septic arthritis is inability to put weight on the joint. Hips and shoulders show less obvious swelling than the wrist or knee. Also, warmth and redness over the affected joint can be a sign of a possible infection. Diagnosis for septic arthritis. There are 3 distinct diagnostic tests that they usually perform to show if a patient has septic arthritis, meaning from bacterial infection, or aseptic arthritis from another cause or a viral source. Before proceeding with treatment, arthrocentesis procedures should be performed to find out what microorganisms is causing the septic arthritis. A needle is inserted into the synovial membrane and extracts the contaminated fluid for lab testing. The synovial fluid analysis identifies the invading pathogen through gram stains experiments, and synovial fluid analysis also measures white blood count. Usually people who have bacterial arthritis show high levels of white blood count because their bodies is trying to fight off the infection. A second diagnostic test is a serum test. This is a complete blood count to determine the presence and number of red and white blood cells that would indicate reaction to an infection. It includes the EDR, erythrocyte sedimentation rate, which is a type of blood test that measures how quickly red blood cells settle at the bottom of the blood sample. If normally they react slowly, a faster than normal rate may indicate inflammation in the body. Also, high levels of CRP, C-reactive protein, indicates inflammation in the body. The last diagnostic test is the synovial lactate test, and it's promising because it could distinguish between septic and aseptic, septic meaning bacterial, and aseptic meaning from another source. Ultrasounds help guide the surgeon when he's performing the arthrocentesis procedure. Also, MRIs can be used to distinguish between septic arthritis and transient synovititis. This slide shows a synovial fluid analysis chart between normal and abnormal synovial fluid. Specifically, we're focusing on cell count, clarity, and color because they're the most obvious indications of septic versus normal or other causes. Also to note, PMS is a type of white blood cell count that includes neutrophils. Antibiotic treatment should begin immediately after arthrocentesis procedure, and antibiotic therapy should last up to 4 to 6 weeks. There are three approaches to the draining procedure. Arthrotomy is a procedure that makes it easier to break down the infection and irrigate the joint space. However, it's known for being an invasive surgery because it requires a large incision. Arthroscope is an alternative procedure that is less invasive because it only requires a small incision for the camera to be inserted, which allows the surgeon to be able to see the internal side of the joint and drain the infected fluid. Needle aspiration is similar to arthrocentesis because a needle is being inserted into the joint space and is draining the fluid. Even though there have been successful procedures more in adult patients, needle aspiration may not drain the joint space as effectively as the other two treatments. The decisions in which draining procedure treatment should be used should be individualized according to the site and the severity of septic arthritis. For example, hip and shoulder in septic arthritis require open surgical drainage, so arthrotomy, because a large incision is needed for a large joint as the hip or shoulder. In the last slide, I just wanted to show in pictures what the different treatments look like and how invasive or less invasive they are. So as you can see, the arthrotomy procedure is very invasive because the whole hip is basically exposed. And then the arthroscope procedure, you could see the camera is being inserted and the surgeon is able to navigate and observe the infection from an internal side view. Needle aspiration procedure, this picture shows how really less invasive this procedure is, and also how sometimes this procedure can't drain as effectively because it's only a small needle pulling out the contaminated fluid versus a bigger incision removing the entire infected fluid or tissue. This concludes the septic arthritis presentation. Thanks for listening.